Hello, I'm Ben Wattenberg. President Clinton has bet big on his health care reform, and Congress is madly rushing to put together some kind of health care plan. But what's really at stake? Joining us to sort through the conflict and the consensus are Paul Starr, professor of sociology at Princeton and author of the Pulitzer Prize-winning book, The Social Transformation of American Medicine; John Goodman, president of the Dallas-based National Center for Policy Analysis and co-author of Patient Power: Solving America's Healthcare Crisis; Theodore Marmer, professor of public policy and management at Yale University and author of Understanding Healthcare Reform; and Stuart Butler, director of domestic policy studies at the Heritage Foundation and co-author of A National Healthcare System for America. Liberals and conservatives, the topic before this House is health insurance, a right. This week on Think Tank. Are you confused about healthcare reform? Hard triggers, soft triggers, medical IRAs, IPAs, PPOs, HMOs, Medicap, Medigap, Medicaid, Medicare A, Medicare B, managed care, managed competition, Hillary's plan, Bill's plan, Clinton light, Clinton heavy, the Nichols-Stern plan, the Cooper plan, the Graham plan, the Dole plan, play or pay, single payer, co-payments, community rating, catastrophic coverage, universal access, universal coverage, global spending caps, health alliances, the Ways and Means Committee plan, the Finance Committee plan, and of course, the resource-based relative value scale, or RBRVS. You don't understand all that? Join the club. Today, we are not going to talk about the paragraph A, subsection 5 aspects of healthcare reform. We are going to try to step back and talk about some basic ideas and principles.
If you send me legislation that does not guarantee every American private health insurance that can never be taken away, you will force me to take this pen, veto the legislation, and we'll come right back here and start all over again.
In the next few months, Congress will decide how to respond to President Clinton's health care ideas and his veto threat. Today, most experts agree that the United States offers the best medical care on earth, and America is the world's leader in medical innovation, developing wonder drugs to treat ulcers, heart and kidney disease, new biotech vaccines, CAT scans, magnetic resonance imaging, organ transplants, and less invasive surgical techniques like laparoscopy. We also have the best educated doctors. But Americans spend nearly $1 trillion a year to pay for health care, almost 1/7 of the U.S. economy, far more than any other country. And while insurance covers most people, it doesn't cover everyone. First Lady Hillary Rodham Clinton headed a 500-member task force which produced a 1,300-page plan designed to guarantee health insurance for all Americans. But behind the complexity, what's at issue? This plan and others being considered by Congress could dramatically change the way Americans pay for health care, how it is delivered, and how they choose their doctors. The fundamental question is whether the government should or can guarantee health insurance for everyone. Opponents of government-guaranteed health insurance have taken to the airwaves with the now famous couple, Harry and Louise.
Rationing, the way I read it. You know, long waits for health care and some services not even available.
Government-controlled health care. Congress can do better than that.
But defenders are trying to blunt these attacks.
He said, what do we do when the government runs out of money? Well, who's out of money now, Harry? There's got to be a better way.
John Goodman, why don't Harry and Louise have a right to guaranteed health insurance? What's so terrible about that?
I think health insurance is a good thing for everyone to have. But if you ask, is health insurance something everyone else is obliged to give to us? Is it a right in that sense? I would say no. And I would say all the other developed countries that declare that health care is a right don't really make it a right. If I'm living in England today or Canada, I don't necessarily have a right to a CAT scan or heart surgery, and even if I need it, I may not get it.
Well, but I think that's a good example of where we ought to be clear what we're talking about. A right to health insurance is not the same thing as a right to health care. It's perfectly possible to be insured against the cost of care you get and to have certain care unavailable. So the first distinction I think we want to be clear about is that the concern about security is about the financial consequences of getting care. It's a separate question about whether we're talking about the right to health or health care itself. I think there's a sharp distinction to be drawn, frankly, between our obligation to one another to cushion the financial consequences of illness and a more controversial view about how much we want to redistribute access to health status, which involves many things beyond medical care.
And I think also, you know, the right issue is a right to what? Even if one were to accept the notion of a right. Is it a right, for example, to a free abortion for everybody in America and everybody be compelled to have coverage for that? Is it a right to have a particular procedure? You know, you've got to get into what are we talking about in terms of specifics, even if you can see
Stuart,
the notion.
Paul Starr, you were one of the fathers or grandfathers of this, the Clinton plan. Why don't you hold forth?
Well, I just want to say Stuart is really now getting into the question of what's covered, what's in the benefit package. I think if you're going to say that there's no right to health care, then are you going to be the one who's prepared to tell someone who's sick, let's take a really heart-wrenching case, a child with leukemia, are you prepared to be the one who says, I'm afraid you can't have treatment because your family has no coverage?
Yes,
because really, no, consult your soul about this, because if you're not prepared to stand in a hospital admissions room and kick people out of the hospital because they don't have coverage, then the issue is not whether people have a right to be taken care of when they're sick. The issue is, do we have an obligation, all of us, to pay for it? That's right. And that is really what a lot of this debate is about. Will everybody be obliged to pay for it? The way we have to pay for fire department, even if our house is not burning, whether we all have an obligation to pay for health insurance, even if we don't have it.
Does everybody have a right to a house with a yard?
No, absolutely not.
But that's the issue. That's the issue, Paul. I mean, you know, you're not the only one who's searched your soul on this issue. Believe me.
Well, let's
and I've lived under a system.
I've
lived under a system in Britain, you know, which does, quote, guarantee a right to health. People do not get particular procedures. There are people in the system who say, you won't get this. Actually, they don't say that. You just don't get it. And the fact is that any system, you know, any situation has to have somebody making some decisions. The issue is who makes those decisions. And what do I get to make them? Does some commission in Washington get to make them? Does Hillary Clinton get to make them? Do you get to make them? That's the issue that we're talking about in terms of
Doesn't the situation now, you were talking about a child with leukemia, through charity wards and emergency wards, I mean, there are most people in America, beyond the 85% who are insured, when they have a health emergency or something very seriously wrong with them, don't they end up getting health care, if not health insurance?
This is one of the great ironies about the whole health care debate. America is probably the only developed country that has not formally stated that health care is a right. And yet America goes further than any other country in saving the cocaine babies and saving people from rare and expensive to treat diseases, even if they have no money.
But John, that is an irony. I agree with that. It's an interesting irony. But I think we're getting away almost instantaneously from the foundational question. What makes us think there's a right to health insurance or health care at all? And then separately, what does that a right to? The separate question.
What is your answer?
Well,
what guarantees us a right?
I think the answer to this question that you've raised about whether people get care or not is that yes, we do pay for the most expensive things. But the great irony in this, and we have a lot of evidence for it, is that people without coverage do get less care.
There's no question about that.
And what they get less of is the primary care, the preventive care, the care that would keep them out of the emergency room.
I read something that the uninsured in America get 60% of the cost of what the insured get, and that's more than people in England or Germany or Canada get.
That may
be
true.
Ben, that's why we can do it. That's why we can do universal coverage. A recent study indicated that covering the uninsured, if we just did that, cover the uninsured, it would raise American health expenditures by 2%.
It's trivial.
I disagree with that.
Do you think most of the uninsured are people who use a lot of medical care?
No, but I think if you
know
insure
it's
them,
not, John.
I think if you expand coverage for any of us, we'll spend more on health care.
Well,
all the studies show that. All the studies show that if you can spend someone else's money in this marketplace, you'll spend more. We'll all spend more.
But if we combine that with cost containment measures,
Which is the area we disagree.
we're going to be able to come out.
If we're trying to get
ahead on
to some fundamentals here, let's talk about what we mean by a right. It seems to me, first of all, we're not talking about a constitutional right or anything
Or a
like
statutory one at the moment.
Right, except to some extent, people do have a statutory right to go into an emergency room and at least be stabilized. That is a legal right in this country.
No, but wait,
the fact that I'm trying to get at what do we mean by this concept of a
But the Clinton
right?
plan establishes it as a right.
Yeah,
That's what he
but
said
wait a
in that
minute,
thing. That's what he said.
But I
They can
understand
never take it
I
away from
understand
you.
that.
It's an
I understand
entitlement.
that. But when we talk about a right, it seems to me in this country, what we're really talking about is Americans in general feel that we are a rich enough country, we have enough expenditures in this area of healthcare. We are at a position where everybody in this country should be able to get access to some level of healthcare. Now, that's not a right in any constitutional sense. It's a feeling that we're at a stage where we ought to be able to expect that. That's really what we're talking about. And everything really flows from that. Then everybody starts using other arguments like rights and legal rights, but they're really that's really fundamentally what we're talking about.
I think there is a consensus on this, and we actually express it in the way we organize our medical care arrangements.
Absolutely.
We do not deny people.
And the moral imperatives that we have.
The moral imperatives, as Stuart says, is right. I think there's been a confusion in the public debate, as if this is a new issue. Are we going to get...
Let me try to get something clear. I mean, here we have two putative liberals and two putative conservatives, and you agree on the idea
at a minimum
of universal access
to help. I think we agree.
Except what I'm saying is that
correct?
ordinary Americans are saying we want that. That's not the same as saying it is a legal right, a constitutional right, or anything like that. What I'm saying is merely an observation about how people in general think about healthcare.
Do you agree with that, John?
Yes, but I think that what Bill Clinton is saying is something more than that.
Absolutely
What
it
Bill
is.
Clinton is
Well,
saying...
let's just say what he said at the very least.
No, just a moment.
Let's try to get...
Just a moment.
Just hold on a minute.
What is Bill Clinton saying to middle-class America? He's saying that I am going to force you to buy health insurance, you and your employer, whether you want to or not. Now, we can call that a right, but what it really is a government-imposed obligation. We're not going to allow you the choice not to buy health insurance. That's what he's saying.
In late 1991, then Senator Lloyd Bentsen introduced a health care bill. A little later on in early 1992, then President Bush added some things on, and it was sort of piecemeal reform. It involved portability, it involved malpractice, it involved universal forms, all the little things, not so little, the big things,
insurance law reform,
but without getting the great government maw involved in it. Could you live with that kind of a plan? I mean, the piecemeal reform idea?
Well, I will, I can in a certain way, and let me explain why. What we're talking about in healthcare reform, or what we've ended up talking about, I should say, in terms of the way Congress is doing is, Congress is trying to look at ways of completely restructuring 1/7 of the entire economy. It is playing with hundreds of billions of dollars. Now, I generally feel that if government does that at one stroke, even if it's something that I may happen to approve of, it's likely to get it absolutely wrong, and it's likely to lead to disastrous
Just because you don't trust government?
That is a major reason. It's not just that I don't trust government. I don't think that anybody who's been, within 10 feet of government can really believe that in a 3-day markup, we can solve all these problems.
Let me ask you a question. If you're Harry and Louise, or 4 Harrys or whatever, all right, and you're sitting around watching all that long list of things that we went through in the beginning, and you got to make up your mind. Is that the question? That you say, Harry, do I trust government? If I trust government, I'm going to go with Clinton. And Louise, if I don't trust government, I'm not going to go with Clinton. I'm going to go with Dole, or I'm going to say no bill till we get some more Republicans into Congress. And John, you try that, and let's just.
Okay, let's go around that one.
How should Harry and Louise have become folk heroes?
There is something.
How should they decide this?
There is something to be said for that. That when you see government about to do something that's going to affect something very personal to you, your own health care, and you realize it's very complicated, and you realize that the complexity changes every week, and you'll never understand it all. It does kind of get down to who do you trust. And if you don't trust the politicians who are about to pass the bill, maybe you should be against it.
And do you trust the insurance companies? Do you think Americans trust the insurance companies more? My colleague Uwe Reinhardt has put this very well. Medicare has never sent a notice. Medicare has never sent a notice to a beneficiary saying, sorry, we've discovered you have cancer, we're no longer willing to insure you. but many people in this country have had the
Paul,
experience
that
of
is the
insurers
kind-
turning their backs
Wait,
on
hold
them.
on.
So as for trust, I would take Medicare any day over a private program, over private
But
insurance.
Paul, that's the kind of absurd trade-off that makes the debate, it makes it so difficult for Americans to really understand what the basic issues are. If you're saying there's two choices, you either trust the insurance companies or you trust the government.
No, but if you
Wait,
have
wait,
that
hold
is
on,
not
wait,
what
wait,
we're
wait,
really talking
just
about.
listen.
I think we've got to get to the
Paul,
fundamentals.
Hold on. Just stop for a minute. Now, Stuart.
You've got to get to the fundamentals of what is it that's causing people anxiety. Why is Harry and Louise concerned? Harry and Louise are primarily concerned that they indeed may lose the coverage they now have. Now, that does not mean that the government has to come in
I
and tell
agree
them what
with
coverage to have. It doesn't mean you have to set up health alliances. It doesn't mean you have to have a commission in Washington to tell them what benefits you've got to have. You've got to deal with some ways of dealing with the insurance companies that are inclined to turn people off and to cut them out and say they're not going to have this benefit. You can deal with that in a very surgical way. You know, you can have microsurgery to deal with that. You don't need to basically obliterate the patient and try and put them back together again, which is what the federal government is trying to do.
First of all, I don't think that's a correct description of what
I'm sure you don't.
of what health reform is about, because in fact, the president's plan is trying to build on the foundation that we have, a foundation of employment-based financing, foundation of private health plans. It's trying to change the rules of that system
Could we agree
to create the incentives, both to control costs and to insure everybody.
Could we
John,
agree on
give
one
John
thing?
Goodman a shot here.
I think this is something we'll agree on. That the president's plan is not even primarily about insurance reform. Most members of Congress, most of the American public agree there should be some insurance reform.
Even you.
Even me.
everyone.
I think once you buy into the system, you shouldn't lose coverage. You shouldn't have your premiums increase because you get sick. Most
should be
people-
portable.
Yeah, it should be portable. That's what I mean by insurance reform. If that were all there was to this debate, we'd probably get insurance reform tomorrow. The president is advocating something
But I think
far
we should
more
not
than
be
that.
discussing entirely whether the president's plan is the right one, but talk about options for dealing with the problems that lie beyond insurance law reform. One of the problems the president's plan and others try to deal with is the escalation of the cost of medical care, because we believe that over time consequences of that will be dire for the rest of the economy and for medical care later on. It doesn't, the Clinton plan has the right objectives. It both wants to expand coverage and to do things that restrain this escalation of healthcare costs, but there are many more ways to do this. We're not talking foundationally here.
Let me ask a question. I am old enough and have been around this town long enough to remember the 1960s, the early 1970s, when the left was saying we ought to reorder priorities. You all remember that phrase, reorder priorities? And if you look at the national spending accounts, the difference between the late 1960s and the early 1990s is what we have done, by George, is reorder priorities. The military budget's gone down and the healthcare budget has gone way up. Now, what on earth is wrong with healthcare costs going up? Isn't that what a humane society ought to do?
In and of itself, Ben, nothing's wrong.
Then
with it. If you
why
think
are you all saying you have to cut? You have
if
to
you'll let me
contain it with-
answer, I'll give it to you. Insofar as we think we're getting value for money, it would be wonderful. We don't have a budget for the purchase of books, and if people think more books is better, that's fine. It's that nobody believes the combination of patchy coverage and health statistics that are not all that impressive and a lot of insecurity is a good value for $1 trillion worth of expenditure. Moreover, the countries with which we do business, that is our competitors, seem to be able to get somewhat better balance among cost, quality, and access than we've been able. That's the negative consensus we've got.
And
where we
that
don't
is the
have
problem.
consensus, let me just say, where we don't have consensus is either on the full range of purposes of healthcare reform, beyond what we've talked about, or what the instruments would do. There's lots of disagreement about if you do A versus B, and we'll never get to them.
No, but-
and we cast the
no,
question
but-
in the Herald.
But the president has put down an approach, proposed an approach that's very radical. He said, he and his wife Hillary have said, we want to push people into health maintenance organizations.
No, that's not.
Wait, just hold on a minute. Let John finish.
And other managed care organizations. And
Fair
what
enough.
the president is proposing is to push Americans into health maintenance organizations and other managed care plans, where the bureaucracy is going to increasingly dictate to doctors how they should practice medicine. Then they're going to squeeze down on the income available to these organizations and force them to ration health care. That is clearly the plan. Now, they may want to describe it in different words, but that is clearly what they have in
John,
mind.
you were describing what's going to happen without reform. Employers now are moving people into managed care plans against their will. Under the president's plan, people would have their choice of an array of alternatives, which would have to include a fee-for-service conventional insurance plan. In fact, without reform, people will lose access to fee-for-service, the conventional kind of insurance that many of them are now losing access to under employer-controlled coverage.
Most of the people who advocate the very reforms that you advocate say that fee-for-service plans will never survive in that market. They will be gone, and people will not have, as a practical matter, that option.
No, I don't think that's right.
Let me put it another way, because I think you may even agree with this. What you have today is a situation where most Americans work for an employer. That employer owns their health plan, determines exactly what benefits they're going to get, how much is going to be spent. Employers today want to spend less. So they're doing things to me as an employee, telling me I'm going to have care in a certain way and so forth. There are various ways of dealing with this. One way is to say, well, let the government make these decisions. Let me write my congressman, and let my congressman decide what I'm going to have, what care, how much is going to be spent. Another way, of course, is to look at steps to give me greater control over how much is going to be spent. Maybe I want to go into managed care. Maybe I think that a cheaper plan that restricts my choice of doctors may be good for me. Maybe I like that. Maybe I prefer to spend more on it. So in other words, we're really talking about a fundamental decision point here. Do we correct a flawed system where somebody other than me and my doctor decide what I'm going to get, which is the employer? And how do we change that? Do we go towards me having greater control, or do we go towards some other institution having greater control?
I want to ask a sort of philosophical question. All this sort of restructuring, this sort of Darwinian capitalism we've been going through in the 80s, has driven a polity to look for governmental nets.
It is upheaval in the economy that is producing a lot of insecurity. It's not just that the number of people with health insurance has gone down. Employer-provided health insurance has gone down. People with employer-provided pensions have gone down too. Employers have been shifting people to part-time. So there is an erosion in what some people have called the occupational welfare state. And it is partly a response to that which we're seeing now. People want something else to provide the security that they can't
That more
get.
free enterprise has driven a demand for more government. Can you briefly, let's go around starting with Paul Starr, briefly, tell Harry and Louise what you all agree on, what you all disagree on, and what they ought to think, briefly.
What most of us agree on, maybe not everybody, is that the insecurity that millions of Americans feel about their health coverage is very deeply rooted. It may be getting worse. There's lots of evidence that it's getting worse. The situation is not stable. We need to do something about that. We don't agree exactly on what that something should be, but it's not as though we're on a stable ship. We're on a ship that's really tilting, and it's going to hurt a lot more people in the rest of this decade unless we take some very significant action today.
I think we agree that the costs are unsustainable over the longer run. I think we agree that there's insecurity, and I think we agree that insurance against the cost of medical care should be made more secure. I think where we disagree is in the diagnosis of what it would mean if the government were to play a larger role in addressing those problems, and we disagree, for example, about the capacity of the private sector to right these wrongs with minimal change. I don't know beyond that what we disagree and agree on, but it's much more agreement than would meet the eye.
Harry and Louise should be concerned that even without a reform bill, that the desire to control costs can affect the quality adversely of the health care that they receive. And I think all of us agree to a certain extent that quality is important and quality is threatened, although on this side we may care more about that issue. But that's it. In the desire to control costs, do we threaten quality? Do we destroy quality? That's what the public should be focused on.
We certainly agree that Harry and Louise, like millions of Americans, really fear insecurity. Insecurity is the root of this pressure for change. We agree on that. I think we also agree here that there are, whatever you do, there are fundamental trade-offs that have not been made clear to the American people. We may disagree a little bit on what some of those trade-offs are, but you can't be presented with there's a perfect solution and no cost. And that's what's been happening on. Where we disagree, I think, is broadly which direction to go on. Do we solve the insecurity problem by giving greater control to governmental institutions on our behalf? Or do we solve this problem by giving greater control to individuals to make decisions and to control the dollars? That seems to me to be the fundamental divide about which way you think is the best one to solve the problem.
Okay, thank you, Stuart Butler, Ted Marmer, John Goodman, Paul Starr. And thank you. We have appreciated hearing from you. Please continue to send your comments and your questions to us at the address on the screen. For Think Tank, I'm Ben Wattenberg.
This has been a production of BJW Incorporated in association with New River Media, which are solely responsible for its content.